Welcome, and thank you very much for the interest in our weight loss program. This is Dr. Patrick Oben. I'm a board certified weight loss doctor here, and I'm here with my wife.
Mayuk Oben.
So we are the founders of WellForm MD. As you can see, we are in our main office, Ankeny, Iowa, where we work with Africans from all 50 states. Now, this program is specifically designed for Africans. Not that the medication is different for Africans, but it's just unique to our culture. We'll talk to you very specific things about your nutrition, the African diet, the African lifestyle to make sure you get the best results possible. So I'm certified in weight loss, and this is the reason why I got into weight loss. My wife. I saw her struggle with her weight. I saw the results she had with this medication, and that piqued our interest in getting into this. So she's going to tell us a little bit about her experience.
I used to struggle with my weight and I lost 50 pounds with the help of the trizepatide injections. I have experienced little to minimal side effects, just mild nausea, and I feel very great. I used to be afraid of the needles, but the needles, you barely feel them. They are so tiny. Like, even after the injection, you don't feel them.
Yeah, thank you. So that's quite a question we get often. You know, many of us we have an experience from Africa with needles. We think, oh, I don't want to deal with needles. But this is the thing, the injections work way better than the pills. In fact, right now we do not even prescribe pills because we don't see the results yet as much. And those needles are so tiny you will not believe they're actually injections. And you take them once every week. Makes it really, really, really easy for everyone to follow. So our program is very simple, really, really simple. It's virtual. It's going to be by Zoom. You're working with us. So I'll be the doctor. My wife is a certified health coach. We have a pharmacist. We have an entire staff here. So you're not just getting a medication ordered online from some random store. We are not a drugstore. We are not even a pharmacy. We are a doctor's office. So you'll be working with a doctor, with an entire team, helping you if you have questions, concerns. You're seeing me regularly. That's why our program is different. And it's very tailored to Africans. We are Africans, we are from Cameroon, right? So we know our diet, we know our lifestyle, we know our issues in the immigrant population. We are here in America. So that's what you're getting. People who understand you, understand where you're coming from. And I'm a doctor. I'm going to work with you with your program. So, how do these medications work? Very easy. They're going to reduce your appetite and they help your body just process food better and help your body burn that calorie better. Are they safe? Absolutely. The brand names, of course, they are FDA approved. That says a lot. It means they are safe and they are effective. Really, really important there. Now, people ask me all the time, what about the side effects? As you can hear from my wife, the minimal side effects we see for her is intermittent nausea, sometimes mild constipation, abdominal pain, intermittent, but most of those get better with time. Now, these medications, when the first one came out, Ozempic, that was the only option we had for sure. Now, many patients took those Ozempic shots. They have very significant side effects: nausea, vomiting. Some of them look older, and it wasn't a great experience, but it worked. Right. Now, tirzepatide is a better version. It has less side effect, doesn't have a lot of the nausea, the vomiting, the abdominal pain we see with semaglutide. It works faster, it works better. In fact, right now, we don't prescribe semaglutide, except that it can be cheaper. Tirzepatide is our best option. That's what we will recommend for you. It will just get you to your results faster. Faster, better, with less trouble and side effects. And these are the results we see in our clinic. The first month, most people lose about 4 to 6 pounds. The second month, they start losing between 8 to 12 pounds. I'll be monitoring that, make sure you don't lose too much or if you're not responding very well. My wife, she lost 50 pounds in about, I think, 5, 6 months. By the 6 month, she had already lost about 50 pounds. Yeah, those are results you can get. And that's the sort of results we get for most of our clients here. The question I also get is there any catch? Is it going to affect my heart, my kidneys somehow? Every medication has side effects, right? But those things are very, very rare. It's like Tylenol. 1 out of 100,000 people can develop dangerous liver failure and die. Does that mean we should not take Tylenol? No. As I mentioned, these medications are approved by the FDA, so they are pretty safe. That's why you'll be working with me. You're not working with some random drug seller online. Right? You're working with a doctor who's going to manage your medications right? Now, the next step for you to get started is going to be just book a free consultation, right? Let's meet on a Zoom call, try to listen to your story and take the next step. Now, the consultations are free. To see me, of course, like a doctor's office, is going to cost you about somewhere between like $100 and $125. However, we've just out of experience. Unfortunately, we've had so many of our clients, they book consultations, they don't show up, or they are not serious about it. They are just curious, no, not serious about it. In other words, just wasting the time of the clinic. Unfortunately, that is really not good for a business. So we have to implement a booking fee so that we want to work with those who are really serious with their weight loss. This booking fee is $9.50. That is not a consultation fee. You can see it's very minimal. It's just to tell us that you're serious. So that when I'm taking off that 30 minutes to meet with you, learn about you, I know this is something which is very serious for you. The other thing that we get here often is, okay, I went to Costco. Somebody told me today, Costco is selling weight loss medications for $200. Why is yours not $200? Okay, and this was my simple answer. You get what you pay for. You're working with us, you're working with an entire office. You don't get that in Costco. You're working, I'm a board certified weight loss doctor. You don't get that in Costco. You're working with Africans, for example, who talk to you, you're free talking with them. I follow you every single time. If you get that in Costco or some online store, it's okay. It might save you some money, right? Our program is really not for everybody. Really not for everybody. If you're looking for something between, okay, it's about $150 to $200, that's really what I want to get. That's what I sell online. Our program will definitely not be for you because that will not even cover the pharmacy we use is quality and it's a little bit expensive. And you're going to follow up with me to ensure that you're getting the right result. So our program might not be for everybody, but if this is what you're looking for, you want to lose that weight, you want to work with somebody you trust, you can understand who follows you up, you want to work with a team, you are not just talking with somebody on the phone, you'll be working with us, then this program is right for you. So just book a consultation now, and then we'll be looking forward to meeting you and helping you take that next step. Thank you so much. We're looking forward to seeing you.